More on the cold weather from Gannon coming up in a couple of minutes, but right now talking about the flu or something like the flu. Everybody's got it right now. It seems like so many people are sick, and we just mentioned a few minutes ago about the visitors restrictions over at New Hanover Regional Medical Center. Dr. Paul Kamitsuka is joining us right now, whose specialty is infectious diseases. Paul, it's good to see you. Thanks for coming in today. So we reached the point that something had to be done to try to stop this, because if folks were coming in, especially children, carriers of the flu, we're going to escalate this problem big time and let it get out of hand, right?
Right. Well, we know the problem this season is that the H3 flu virus mutated. And so, unfortunately, the flu shot is less good at covering this particular strain of flu. So we've had a surge of H3 virus infections. In fact, about 95% of the flu that we've been seeing across the country has been the H3 virus.
Would you recommend people still, though, get a flu vaccination?
I'm glad you said that. Yes, definitely, because typically in a flu season you may have several strains that circulate. And so it still is important to get the flu shot, because other strains which may be included in the vaccine may circulate later. We're still early in the flu season, unfortunately.
Yeah, we got a long ways to go until a few months from now. Now, I know you said you had the flu or something like it. Symptoms of the flu would differ from a cold. You would definitely know if you've got something like the flu or something close to it, right?
Right. So flu has a spectrum of symptoms, but typically what you see is fever, you ache all over, you cough, you have a headache, you may have a little bit of a sore throat, not just the sniffles like a common cold. You're sick, and so generally you know that you're ill, and it's important, if you develop those symptoms, to call your healthcare provider early, because the anti-flu medications really only work if you give it within the first 48 hours.
And there were some reports not long ago that one of those medications, Tamiflu, was in short supply.
Right.
Is that still the situation?
Well, the supply is still, it's not robust like we'd like it. Yeah. So it's a little spotty, so that we would emphasize the importance of using medicines like the Tamiflu, particularly for people who have underlying risk factors for flu. If you have heart and lung disease, asthma, things of that sort, any immune deficiency, then you in particular should be a target for getting the early treatment.
Yeah, the story a few minutes ago, we had 17 people have died attributed to the flu in the state this year.
Right.
And again, we're still in the early part of the flu season. That number certainly could go up, right?
Right. So and the folks that are succumbing to the flu are primarily people who are elderly, people who have underlying heart and lung disease. And they are also the ones that are least likely to respond to things like the vaccine. So that's why it's important for all of us, in fact, anybody 6 months of age and older, to get vaccinated to try to protect against hopefully other strains of flu that may circulate.
And it's so important. We hear it, we stress it. Still wash your hands, protect yourself. There are a few things you can do, right?
There are things that you can do. Washing your hands, using hand sanitizers, coughing into your elbow instead of out or onto your hands. The hands and secretions are ways that the flu virus spreads.
All right, Paul's a good friend of mine, so I'm not going to shake hands. Okay. How about a
fist bump?
Let's do that.
Okay, sounds good.
Paul, take care. Thanks for coming in.
Thank you.
All right, over to Gannon right now. You and I have been in pretty good shape. This hoarseness, of course, something else, but we've avoided it so far, Gannon.
Yeah.